In this module, I would also like to introduce you to monitoring therapeutic drugs with therapeutic range. Monitoring therapeutic drugs involve measuring drug concentration in plasma, serum, or blood. The measurement of drug concentration in plasma or blood correlates better with adverse effect than the dose of the drug itself. Monitoring drug concentration is useful when drugs are used to prevent an adverse outcome, example, graft rejection, or to avoid toxicity. Example will be antibiotics, the aminoglycoside. Now let's see what are the criteria of drugs that require therapeutic drug monitoring. The first one is the drug that have narrow target range. Secondly, the drugs that have significant pharmacokinetics variability. Thirdly, the drugs that have reasonable relationship between plasma concentration and clinical effects. Fourthly, drugs that have established target concentration range. And finally, the availability of drug is. Why do we perform therapeutic drug monitoring? We perform therapeutic drug monitoring to gain information about efficacy, toxicity, approximate dosing, and to diagnose a failed therapy. During monitoring process, we want to know if the drug is effective to treat the disease or not. Besides that, we also want to know, is the patient undertreated or overtreated? For toxicity, we monitor the patient to identify any toxicity symptom present due to the disease or to avoid toxicity to ensure safety and therapeutic level is administered to the patient. We perform therapeutic drug monitoring to approximate dosing. After dose adjustment, we measure the plasma drug concentration to assess the steady-state concentration. We also perform the drug monitoring to assess whether the loading dose is adequate or not. Example will be phenytoin as a treatment for seizure. And lastly, to diagnose a failed therapy. Drug monitoring can distinguish between ineffective drug, non-compliance, and adverse effect that might mimic the underlying disease. If you're not sure how to monitor a certain drug, you can get the information from the BNF. This is just a list to show you the most commonly monitored drugs. We have digoxin, lithium, phenytoin, cyclosporine, sirolimus, tacrolimus, vancomycin, sodium valproate, amiodarone, and also DMARDs. The target concentration in therapeutic drug monitoring. The target concentration depends on the indication for the drugs to be used for the treatment. Example, dose of a digoxin depends on whether it is being used for atrial fibrillation or for congestive cardiac failure. When do you take plasma sample for drug monitoring? Usually, we take sample at steady-state concentration, which is 4 to 5 half-life after starting the therapy. At steady state, plasma concentration is proportional to the receptor concentration. So that is why we take sample during steady state concentration. Apart from that, if the drug has long half-life, such as phenobarbital or amiodarone, sample can be collected at any time point. Sample taking at the time of specific symptoms may detect toxicity. Example, carbamazepine or lithium. The timing of sample collection is important as drug concentration changes during dosing interval. The least variable point in dosing interval is just before the next dose is due. This is called trough concentration. What do you document when sending samples? The first thing that you need to put is time of sample collection. Next is time of the last dose, dosage regimen, And lastly, indication of the drug. So these are the information that must be sent together with the sample. Once you have received the result, how do you interpret the result? Before interpreting the result, you must ensure sample was taken at the correct time and you must know the current condition of the patient. Example, whether the patient has got any electrolyte imbalance, if the patient is hypokalemic and received digoxin, so you must consider all this. Next, interpret the result in context of individual patient. You need to consider adjusting the dose of the drugs if required. And don't forget to explain to your patient about your management. Few advice from me. Doctors need to practice the drug concentration is not a substitute for clinical judgment. It is important to treat the individual patient and not the laboratory values. Purpose of drug monitoring in pediatrics. In pediatrics, we closely monitor treatment to optimize the management of patients receiving drug therapy for the alleviation or prevention of the disease. In general, the steps in monitoring is the same as adults. There are few considerations that you have to know about pediatric patients. Close drug monitoring is essential because neonates, infants, and children undergo major and rapid age-related physiologic and biochemical changes, especially during their first year of life. Pharmacokinetics of drugs in neonates and children are unstable. Absorption, distribution, and clearance change with age. Therefore, it is essential to optimize drug efficacy and avoid toxicity. Measurement of drug concentration must be taken at the time of the expected peak or trough level for accurate interpretation. Random sampling is not advisable in pediatric patients. Special care is needed in ensuring the drug prescribed is appropriate and that the correct dosage is given, especially in neonatal period. Few facts about drugs used in neonates that you need to know. Neonates are composed of less body fat and more water, which leads to differences in the apparent volume of distribution between neonates, children, and adults. Changes in gastric pH and gastric emptying time during the neonatal period leads to variation in the absorption of many drugs. Slow total drug clearance in premature infants and neonates is due to immature hepatic and renal function. Immaturity of hepatic microsomal enzyme system produces slow biotransformation of many drugs in premature infants and neonates, requiring a low dosage to achieve therapeutic concentration. Monitoring special conditions. Some drugs can develop tolerance and dependence, particularly after long-standing use of the treatment. Regular monitoring will allow you to identify these problems. Be careful with substance misusers who attend to you for another matter, asking for prescription from you. You should have a clear strategy when they ask about prescription. Okay, students, now you have come to an end of this module. Just a recap what you have learned. You have learned about passive and active monitoring, decision to stop, continue or change treatment plan, monitoring drug with therapeutic range, monitoring drug in children, and monitoring drug in special condition. I hope you enjoyed this module and good luck with your practice.